there seems to be a bit less openness in the medical field than in other fields. That's just the way it is. And I'm not going to yell and scream anymore. I just stopped. I just left the university about 5 years ago and just stopped teaching integrative medicine. Because as any nutritionist will tell you, that vitamin D is important, D3K2 and CoQ10 is important for heart health. And how many times I ever taught it to the cardiology fellows, not a single one ever ordered it for a patient. So you just have this type of things that this stuff is magic, it's salt water. Well, it's wrapping your mind around mitochondria. If you're a neurologist or you're an endocrinologist or a rheumatologist, where something affects every part of your body and everything is linked together, is something that the medical field is not yet ready, still not ready to think about and wrap their brains around. It's just not the way we're taught. We're taught to think in silos, and this is more of this transcends the silos. So I've been studying waters and structured waters for some time, and I had tried a half a dozen different products out there and so on. So ultimately, we had about 100 or so patients on a certain product that ultimately became a pharmaceutical product that is not yet available, but is being used only in quite very severe illness. So I was looking for an alternative, and then poof, I show up to a meeting, and then I meet Miss Handloff, okay, so, Masami. So she has a fire, ball, and has a great story of her own that's perhaps more intense than mine. But I then put the same 100 people on the same stuff, and they basically had a better effect. So if that's the case, then I say, well, now it's time for me to study the science, because the science is always a little bit unique. It's different. And what does it teach us? And so we got to go in that direction. So the science was already largely done. So it was easy. And then I just tried it myself. And then I could feel it immediately.